The price tag to send cancer patients to Bellingham, Washington for radiation therapy has hit $16 million so far. Of that, $13 million has gone to 2 private American cancer clinics, which have treated just over 600 British Columbians in the last year.
This is not only, to me, hypocritical, it's also an example of wasting taxpayers' dollars.
Vancouver Dr. Brian Day spent years fighting the BC government in court over private health care. He runs the private Cambie Surgery Centre, which was at the center of a 14-year-long legal battle over whether patients should be able to pay for services covered by BC's medical services plan.
They basically spent tens of millions of dollars opposing private options in Canada, and yet are supporting private options in the United States. This makes no sense.
A spokesman for Canadian Doctors for Medicare says while he's glad patients are getting speedier access to cancer care, BC should not be relying on the U.S. to do that.
I think it's a tragedy that in a country as wealthy as ours, that we're not able to provide care to our patients in our own country.
But Mitchell claims the private system Day was advocating for through the court challenge would not help everyday British Columbians get better care.
The Supreme Court of British Columbia found that the system that he was proposing would lead to a system where ability to access care was contingent on ability to pay. And these patients that are going to Bellingham are receiving their care free of charge. They are receiving it funded by the public system.
Health Minister Adrian Dix stressed the Bellingham program is a temporary measure over the next 2 years while the province builds 4 new cancer centres in Surrey, Kamloops, Burnaby and Nanaimo.
The reason we're in Bellingham is to ensure that people are protected in the meantime.
Dr. Claudine Stornis-Bliss, a doctor at Surrey Memorial Hospital and BC United candidate for Surrey Cloverdale, says if her party forms government in the fall election, it would increase the use of private medical clinics to deliver publicly funded health care. She claims the NDP's refusal to do so puts patients at risk.
They are putting ideologies ahead of patients. They are already using private clinics, both in BC and in Washington State. They are just not using it to its full capacity.
While there are signs the wait to see an oncologist in BC is getting shorter, the province continues to have one of the longest waits in the country for radiation treatment. Katie DeRosa, CBC News, Victoria.